Hey guys, in this video, one of the things we're going to be talking about is the changes of what incurred in 2023 that's probably affecting you now and you just don't realize that those changes occurred in 2023. Stick around. We're going to dive into those details in this next video. I'll be back in just a second. What happened in 2023 with the Inflation Reduction Act that was huge to Medicare beneficiaries? One of the things that what's called as the insulin cost cap implementation occurred for 2023. Starting January 1st, 2023, the IRA mandated that all Medicare prescription drug plans cover insulin with a monthly cap of $35. So if the carrier is going to choose to put insulin onto their plan, they had to have a $35 cap on the copay. This requirement extended to insulins covered under durable medical equipment pumps as of July 2023. So what kind of an impact did that have? Overall, over the last probably 5, 6, 7 years, we have seen a huge options for Medicare Advantage plans, their dental, the hearing, the vision, the copay costs, all these things. The plans have just gotten better and better and better and better. Now, over the last 2 years, what we've seen is they stabilize, and all of a sudden they begin to degrade some of the benefits based on incurring costs when they were taking on, like, okay, we're going to have insulins on our formulary at $35 copay. That means we're going to have incurred cost, and they begin to degrade some of the benefits or copay costs, and you saw some changes in Medicare Advantage plan. But at the same time, some carriers came on board and continued to improve lower copay cost or more dental, hearing, vision. You may be in an area that had extremely lush, big benefits. And one of the big things that we're going to be talking in this next video is what's occurring in 2024 that's going to make catastrophic changes to most health plans, and why you need to be aware of it is if your plan is, you've seen just increase, the plan has gotten better in the Medicare Advantage world, there's going to be a potential for those plans to change and costs changing that's going to be occurred, and we'll talk about that in another video. So what exactly happened that was so great was this implementation of the $35 copay, consistency and compliance, participation and compliance by law. All plans were required to comply with this cost gap that was incurred. This was not optional for plans that chose to participate. The $35 cap on insulin costs was a mandatory provision of the Insulin Reduction Act. So the IRA mandated all prescription drug plans to have this $35 cost, and thus for you guys that are on insulin-driven medication, you rejoiced and cheered, because for years we saw people catastrophically have major problems covering the cost of the medications. Now, the implementations looking in and ahead to 2025 is what we're going to be talking about in this next video. If you guys stick around, or if you do have questions and you're like, hey, I'm kind of afraid of what's going to happen, my encouragement to you is make a note at the end of September, your annual notice of change is going to come in the mail, and that annual notice of change is going to have a side-by-side comparison of this year, 2024, and then 2025, and the changes occurring. And if you see some cost in your premium costs going up and some other things we're going to cover in this next video, but if you see increased changes and you're confused about that or concerned about that, then get with a licensed professional or expert like us. You can click below and be able to contact us. We'll schedule a time and be able to walk you through that process. I would encourage you this year of all years, this is probably the biggest, largest implemented changes that we're going to see across the industry that I've seen in the lifetime of me doing this for 17 years. There's going to be major changes, and you need to read up on, and as we provide more and more content, like, subscribe, and follow us. We're going to provide you more and more content as that becomes available to us, and then other educated deep dives into these topics and how they're going to affect your cost.